Hi, my name's Mayada. I'm one of the regional facilitators covering the North on the Trainee Pharmacists in GP programme. I work with my colleagues Cindy and Brenda, and I look forward to meeting you all over the coming 12 months, and I wish you all the best.
Hello, my name is Brenda Sandhu. I'm the Regional Facilitator for the Trainee Pharmacist Foundation Training Programme in General Practice. I work in the Yorkshire and Humber North East region, and I work alongside Ellie. We look forward to meeting you all, and I hope you have a fantastic year.
Hello there, my name is Cindy and I'm a North Regional Facilitator. Together with my colleagues Mayada, we cover Cheshire and Merseyside, Greater Manchester and Lancashire. Firstly, I'd like to say congratulations on getting the cross-sector placement. There's going to be lots and lots of learning opportunities coming your way, so grab them with both hands and I hope you have a fantastic year.
Hi, my name's Ellie Wakeling. I'm a regional facilitator on the GP training programme for trainee pharmacists. I work across the north with Brenda, Mayada and Cindy. So you'll see either myself or one of them around if you're based up here. Wherever you're based, I hope you have a wonderful training year and love every minute of it.
Hello, my name is Busola Daramola. I am one of the regional facilitators for the Trainee Pharmacists in General Practice program. I cover the East of England area and I'm wishing you the very best in your training year and subsequent career as a pharmacist.
Hello, my name's Neha Ramaya. I'm one of the regional facilitators for the Trainee Pharmacists in GP programme for the Midlands. Welcome to your training year. I hope it's an enjoyable experience and I look forward to working with you throughout the year. Good luck.
Hi, I'm Xenia Bray. I'm one of the regional facilitators in the South. I'm really looking forward to supporting you over the coming year and wish you all the best with your training.
Hello, my name is Caroline Murphy and I'm one of the regional facilitators for HEE South with Xenia and Reese. I wish you every luck in your training year and I hope you have a wonderful experience, and we'll see you at the training events.
Hi there, I'm Reese Martin and I am the regional facilitator for the Trainee Pharmacists within GP Practices programme, and I look forward to meeting you hopefully in person soon, but certainly virtually through some of your training events and some of your face-to-face events.
We will now introduce you to the Trainee Pharmacists in General Practice programme. So what do the placements look like? The majority of you will be spending 13 to 26 weeks across your training year in general practice. There are many different models. They could be as split weeks, it could be block placements, or it could be as a single block. The model employed will be dependent on many factors, including the working pattern of the designated supervisors, the number of trainees and the distance between the general practice and the pharmacy. All the models ensure that the trainee is based with a designated supervisor for the appropriate number of hours per week as set out by the GPHC. The trainees will be supported to meet the placement objectives and the outcomes and have multidisciplinary learning in general practice. All trainees will have a designated supervisor based at both the employing pharmacy and at the general practice. Your supervisors have a number of roles. These are supporting you to get the best from your training year, supporting your practice and providing feedback, providing support and guidance to other staff who are supervising you, providing regular feedback based on the observation and review of submitted evidence, declaring if you're competent and, based on the evidence gathered throughout the year, communicating with the employing pharmacy supervisor, and also supervising learning events in line with the assessment strategy, which will be explained later. The placement objectives are for you to understand the role of the clinical pharmacist in general practice and also the wider team, to develop your communication and consultation skills, to undertake some basic clinical assessments, which we'll explain on the next slide, to monitor ongoing treatment, to make recommendations for chronic conditions, to understand the need for a holistic approach and the importance of shared decision making, and to promote health and make every contact count. So the placement outcomes depend on how long you'll be spending in general practice. For those of you that will be spending 13 weeks in general practice, we would expect you to have a good understanding of general practice and the role of the pharmacist as part of that team by the end of your placement. We also expect you to undertake a minimum of 2 assessed basic face-to-face patient medication reviews and receive feedback. I'll explain a bit more about a basic review in a second. And I mentioned the basic clinical assessment, so some suggested ones are height and weight, measuring BMI, measuring the heart rate, respiratory rate and temperature, measuring someone's blood pressure, also oxygen saturation levels, completing a urinalysis, capillary blood glucose, and measuring someone's peak flow. During COVID, due to less face-to-face patient interaction, some of the trainees last year and the year before did complete these on colleagues, other medical professional students, and family and friends. Hopefully, you will be able to see patients face-to-face. However, it is acceptable to practice on other people under supervision. If you are undertaking a 26-week placement, by the end we'd expect you to have an in-depth understanding of general practice and the role of the pharmacist, and to have undertaken a minimum of 4 of the medication reviews and receive feedback, one of which of these we'd like to be more complex. Also, you would need to undertake the basic clinical assessments and have completed a quality improvement project or an audit cycle. So a basic review may be post-discharge review following an MI, so you're focusing on one condition. You would complete a discharge reconciliation, make the appropriate monitoring, for example, target blood pressure, cholesterol and U&Es, and then counsel the patient. A more complex review would be multiple medications for more than one condition, which would involve polypharmacy and sort of known adherence issues due to the number of medications and conditions involved.
The General Pharmaceutical Council has introduced new standards for the initial education and training of pharmacists. Within these standards are 55 learning outcomes, which are to be achieved across the MPharm degree and also the foundation training year. The learning outcomes are organised into 4 domains, which you can see here on the slide. We have person-centred care and collaboration, professional practice, leadership and management, and education and research. By the end of your foundation training year, you will need to be signed off by your designated supervisor on 54 of these learning outcomes. These are referred to as the interim learning outcomes and have excluded the outcome linked to being an independent prescriber. The interim learning outcomes have to be met at the appropriate level on Miller's triangle. The foundation year, the majority of the learning outcomes must be demonstrated at the does level of Miller's triangle, that is, in an everyday situation, repeatedly and reliably. In order to successfully complete the foundation training year, you must be signed off against all the interim learning outcomes by your designated supervisor, and in addition, you must complete the number of required weeks in training, so this is the equivalent of 52 weeks full-time equivalent, and successfully pass the GPHC registration assessment. To support you, Health Education England Foundation Year Assessment Strategy has been produced. This assessment strategy directs you to complete a range of defined assessment activities which are mapped to learning outcomes, and they support you to provide evidence to demonstrate all of the learning outcomes. With regards to the type of activities, we've defined 5 groups of activities as listed here on the slide. So we've got Group A. This is clinical and patient-facing activities, so things such as those relating to providing patient-centred care. Some may be directly patient-facing, others may be through interaction with other healthcare professionals. In Group B, we have healthcare quality and improvement. So here, activities such as quality improvement or audit projects and education and training. In Group C, we have supplying medicines activities. So these may be things such as technical skills, processes such as dispensing, accuracy checking, but also ensuring the legality and technical accuracy of prescriptions and other medicine supply procedures. In Group D, we have mandatory and specific training, so those things may be required by your employing organisation, and those included in the learning outcomes such as first aid training. And finally, we have Group E, personal development and progression, and this includes activities such as learning needs analysis, personal development plans, feedback from colleagues and from patients, and these activities should be done regularly through the year. So for each of the grouped activities, there'll be 3 to 7 things per theme, so 3 to 7 activities per theme, and you must complete a minimum of 1 of each of the assessment activities using a range of assessment tools that will be provided for you. So let's have a look at some of these tools in a little bit more detail. What's available to you to support you to record this assessment activity evidence? So some of these tools might be familiar with you already, some might be new, but we have things such as supervised learning events. So this may include mini clinical evaluation exercises, direct observation of practice, case-based discussions, so looking at patients in more detail and depth, and also consultation skills assessments. We also have contribution to care logs and reflective summaries. We'd expect you to have feedback on your practice, and this can be done using 360 feedback tools, patient satisfaction questionnaires, for example. It's really important that you have discussions with your designated supervisor and identify your gaps in your knowledge and your competence, so completing learning needs analysis. You'd be involved with peer assessment, producing competency logs, and also evidence of your continued professional development. Completed inductions, certificate of events, attendance at courses and completed projects, of course, also will form evidence towards the assessment activities. So let's have a look at how this relates to what you're going to be doing on a day-to-day basis during your year. So some examples here from general practice. So perhaps you're completing a meds reconciliation. So you're getting evidence for Group A of those assessment activities, clinical and patient-facing activities. So you choose to complete a mini clinical examination or perhaps a contribution to care log. Undertaking chronic disease consultations. Here perhaps you want to look at your consultation skills. So you choose to use the tool MRCF. And again, this is getting evidence for Group A, clinical and patient-facing activities. And a third example from the same category, undertaking physical assessments. But maybe here you're choosing to focus on the direct observation of practice tool to demonstrate it. Looking at a different category, Group B, healthcare quality and improvement now, perhaps you're preparing to deliver an education session for the practice team. So you choose to use tools such as lesson plans, participant feedback, reflective summaries, and maybe peer assessment. So you're using physical tools, getting that physical evidence to demonstrate the competencies that you have. And all these assessment activities, as I said right at the start, are cross-referenced and link in to the learning outcomes for the GPHC.
So what support is available for you, the trainee, during your training year? Well, locally, you have your designated supervisor. So whichever sector you're working in at the time, you have your direct supervisor there, but you also have your supervisor from the other sector who you may also have a good relationship and choose to actually contact. You have the regional facilitators, so us. We're here to be able to give you help and advice and help maybe facilitate conversations that you may need to have. You have your peers, your fellow trainees. So the people that you're doing this training with now, people who you'll be forming relationships throughout the year, will actually be able to give you some help and advice as well. You have your work colleagues. So again, from whichever sector you're working in, whichever sector you've worked through, you have that ability then to be able to actually talk to some of those colleagues that you may have developed relationships with as well. The wider HEE team. So we as the regional facilitators are one arm, but there are lots of other arms you could also speak to. The GPHC are there for advice, especially on any matters that may be of a regulatory kind. But again, it may be a conversation that you'd have had after speaking to other people first, depending on what the matter was. And you may also have an external training provider depending on the setup that you have for your training provision within your year and for who is actually delivering those training. So you have lots of different support available to you. So what about resources that you have to support your year? So you need to record your progress. As you're going through different sectors and working in different placements, you'll need to use your e-portfolio to record that progress. Because you're going to be having multiple tutors and because you're having tutors from different backgrounds, it'll be very important that you really utilize your e-portfolio to its maximum ability. You will need to fill this out on a regular basis while things are fresh, while you can remember what you've done, so don't leave it too long. And that will then help you to map all these learning activities against the evidence and against the GPHC learning outcomes. This will help you when it comes to your appraisals. It'll help you if you have any queries. It'll help you to be able to show yourself, to really demonstrate how you are providing the best possible opportunity to yourself to pass your year, to be able to be successful in your assessments. And of course, it gives anybody who comes to look at it a picture of you by showing the tasks you've done, what skills you've developed, what you've been able to actually demonstrate within the different sectors that you've worked on. So it's very important to own your e-portfolio, because that is really going to give you a great picture of who you are through your work. Within this, you're going to have a lot of references that are linked to the assessment strategy to be able to turn to get some advice. You're going to get the blank templates if you have so many learning events, supervised learning events coming up. So within the actual e-portfolio, there's lots of resources to help you actually how to use that to the maximum. And I'd strongly recommend that you make sure that your e-portfolio is as good as it can be. So what about if you've got any concerns? Who do you turn to actually raise any concerns? Well, it's not going to be a definitive list. There's not going to be an exact person for every scenario. So sometimes it'll depend on what your concern is, and it will depend on exactly who you need to speak to would be best, because again, it may be a concern within a particular sector. It may be a concern about the person themselves. So this isn't a hard and fast list, but this is just a good suggestion over what may be a good sort of path to follow. So you've got your designated supervisor. So they are going to be that first person who is looking after your whole program, is going to be looking after you all the way through. You've also got maybe the education program director or the pharmacy manager. So again, depending if the designated supervisor is not the suitable person for any reason, then you've got the lead who could also be there. You've got your training program facilitators or leads. So again, this may be through HE, maybe through an external provider, but again, depending on what the issue is, and maybe something that you just want to maybe ask just a sort of a discrete question, just to find out some information. So again, it depends on the sort of query that you have. You've got us as your regional facilitators from HE. We're people that can help you depending on whether it's something that you just need a bit of direction or guidance on, or something that maybe you need to follow up with. You've got other people within your organisation, again, thinking of things like a HR issue, or thinking of things that may be a more of an employment sort of issue. So it may be more appropriate to speak to a HR manager or other or similar. You've got pharmacist support. So again, depending on where your query lies, you may find that it's a pharmacist that you've worked with that you want to turn to, or you may find that actually it is a recognised sort of helpline. For example, you've got the Speak Up helpline, which is a free, independent and confidential advice for all NHS and social care sector workers. So again, you can access it via telephone number, via a website. So there's lots of other places that you can also turn to raise concerns or for support, for advice, and lots of different employers will have helplines, will have different mental health sort of advisors. So there's lots of other support available, just depending on exactly what it is that you need the support on.